Hello and welcome state teams to year 5 of the grant cycle. We are kicking this off with a State of the States address, similar to the State of the Union, but with a little bit of a Mountain States flair. And I know what you're thinking. You're wondering, Christy, how can we possibly be in year 5 of a 4-year grant cycle? We thought this grant cycle was only 4 years, and you would be correct. HRSA has asked us to count this as year 5 because we're taking 4 years of this grant cycle and adding it to 3 years of the previous grant cycle. And so with those 3 years plus the one we just completed going into our second, that gives us 5. And so with that, Cody and I are so excited to be here to give you some updates about some new things we have planned for Mountain States, some new processes, and some updates on projects that got launched in last grant year. And with that, I'm going to go ahead and show you what we're going to be talking about today. So first, we'll start off with Cody's new role, and then we'll go into genetic navigators and the time for genetics clinics updates. And then Cody will tell you a little bit more about the state team projects and funding, as well as the genetics summit. So with all that, let's get started. And I just want to ask that you all join me in welcoming Cody to his new role. We have really enjoyed having him as part of our team over the last year, and with Joyce's retirement, he has graciously agreed to step into the role of state team coordinator and will be taking over some of the responsibilities that Joyce held. And with that, some of the things that Cody will be leading will be still the things that you know him for, which are those reminders for the invites and meetings. But he will be also your main point of contact for state team changes. So if anyone is leaving a team, anyone's coming onto a team, please contact Cody first and make sure that that person is included on our list so that they will get all of those notifications for the state team events. Also, he will be the main Mountain States Regional Genetics Network staff attending all state team calls. I can be on calls as requested, but will not as a common course be on all the state team calls. But Cody will be your point person, and he will be that point person also for state team questions and inquiries. Again, I am here. Cody and I work as a close team, and so I'm here for backup, but he is going to be the person on those calls and your first point of contact for anything related to state teams. He will be assisting state teams in updating their websites and working with the state teams on projects and funding proposals. He'll talk about that in a little bit in more depth. And he'll also be working, as he has in the past, with the co-leads for minutes, agendas, and leadership needs, and always there to answer any questions that you all have. And we're both here to support the state teams in any possible way that we can from Mountain States. With that, we'll switch topics and talk about our genetic navigators. We are thrilled to have 8 individuals joining us as our genetic navigators for year 5. These individuals have all gone through extensive training in the last grant cycle, 5 hours and 8 modules of training, and they are now ready to help families in their respective states navigate the genetic services system. In order to connect with these navigators, we have set up email addresses for each of them. The format of the email is just the state name and then the word genetic without an S, so singular, not plural, @gmail.com. And these emails are available on our website. They're available to you as state team members to share with families and share with your networks to introduce them to your networks. I encourage you, if you don't know the genetic navigator for your state, to reach out to them at this email, welcome them, and connect with them in your personal or professional role as well. These individuals, many are familiar faces and have been part of our state teams for a while, and even in leadership roles and co-lead roles. And some of them are new to the state team. So we are looking over the next couple months to introduce those who are new to the state teams to their respective state teams, and those that have been part of the state teams may be assuming a little bit of a different role. They might be stepping down from a co-lead position so that they can spend some time, dedicated time to this role. One thing that I do want to stress with this new program, though, is these genetic navigators are here for the families in our region. While they are amazing advocates and amazing individuals that have done so much for our state teams, we want to be cautious of not overburdening them with state team projects or responsibilities, because their focus will be on the families in our states. It is our hope that they will be able to inform the state teams on possible project ideas, because they will be the hands and feet on the ground, working with families, discovering barriers to care that maybe the state team might want to address in future projects. So I look forward to this partnership between the genetic navigators and the state teams, and please help me in welcoming them and joining together with them to help families in our region. The next update I have for you is a Time for Genetics initiative update. It's been really exciting seeing this program launch this year, but it could not have happened without you all, without our state team conversations with primary care providers and your recruitment activities in your own state. We have 7 clinics recruited and actively participating in the program. We launched in April with our first topic, which was red flags for genetics, and we're getting ready to finish that up here in July. We'll be launching our second topic in August, which will be developmental delays. And our third topic will be launched in December, which will be Ehlers-Danlos syndrome. All of the materials and all of the resources for these topic areas are being archived on our website. So you can go to mountainstatesgenetics.org/T4G, which stands for Time for Genetics Library, and you can find those listed there. With that, we are so excited to get ready to launch cohort number 2 for fall of 2021 and spring of 2022. And we are going to be recruiting immediately. The due date will be November 15th for these clinics. And if you all remember from the video last year that I made, we need 2 clinics from every state to grow this program this year. We have a new process, though, in mind that we hope will make this easier on all of you as state team members. And that is, we are going to have an application by the clinic to be part of this program. So that application can be given to the link to that application can be given to any clinic that's interested in your state. So you have a couple different new recruiting tools in your belt. You can spread this far and wide. You can contact your American Academy of Pediatrics chapter. You can contact your AFP chapter, American Academy of Family Physicians. You can spread this far and wide to find clinics who might be interested and then ask them to apply. Or some teams might have an idea that they have 2 or 3 that they want to ask first, and you can go directly to them and you can give them that application and ask them to apply. If you remember, this is a slight change from last year in that we asked one of the state team members to fill out a form nominating their clinic. This time we will be asking the clinic to fill out the form to apply to be in the program. The application is there, and with this next slide, you can get a sneak peek of it. The one with the clocks at the top will give you a clue that you're on the right application there for Time for Genetics. And we have 16 spots available, as I said, and this application should take no longer than 5 minutes. Really just some demographic information. And this slide here, if you look on the right-hand side, anything with a star there is a required question. And there's just one question that might take more than a one-word answer, which is, why does your clinic want to participate in the Time for Genetics initiative? We have a link to the video as part of the application. We have a link to the agreement so they can review that. How did they hear about us? So they can mention if someone from the state team referred them. And that should all take just about 5 minutes to apply. We will be picking clinics then in later November and be notifying them by December 1st of their entry into our cohort number 2. So with that, I am going to turn it over to Cody to talk about state team funding and projects for the year 5 of our grant.
Thank you, Christy. As you mentioned, I'll be going over state team projects and funding for this grant year, and then closing with the 2021 Genetics Summit on November 9th and 10th. So first, thank you to all of you for the wonderful projects from this past year. Colorado and Utah collaborated to print 6,000 custom Where is Bear developmental delay books in both English and Spanish. Montana purchased 2 laptops and an iPad as telehealth equipment for a lending library. Nevada printed 1,500 genetics resource magnets, and New Mexico funded a local nonprofit to provide respite care for families, and of course, much, much more. As part of an ongoing effort to track outreach, Christy and I will be back in May of 2022 for data on the projects from this past grant year. This is largely project specific, and we should have discussed this with you at some point. If you have any questions, please don't hesitate to reach out. And if data becomes available sooner than May, please feel free to share that with Christy and myself to take it off your plate. Moving on to next year, this year, year 5, July 2021 through May 2022. Moving into this year, we're going to try something a little different. Money is still available to work on your projects, but we're trying a new way to distribute this. There will be 2 rounds of funding this year. Round 1 from today through November 15th of 2021, and then round 2, December 1st through February 15th of 2022. In round 1, you and the other 7 state teams can submit an application for up to $2,500. And in round 2, any funds not claimed in round 1 will then be pooled together and open to the 8 MSRGN state teams. So 2 key things I want to emphasize. I know this is an accelerated timeline and a change, so I look forward to supporting you in this. And again, if you have any questions or feedback, don't hesitate to reach out. And then funding is still available, but there is an earlier deadline and you now have to apply. So with that, we'll get into the actual application. So this is what you'll see when you open the link or copy the web address into your browser on the screen. I encourage you to take a look yourself, but as a quick rundown, we're asking for the amount and where it's going, how it improves or increases access to genetics in your state, and the main point of contact if the project involves handing it off to another organization. This is our best attempt at providing you upfront what the management team will be interested in when we discuss any proposal. And again, feel free to reach out with any questions. And if we go to the next slide, this is just a copy of everything you can find in that application itself. On the left is the introduction, and then on the right are all the questions. But again, I encourage you to take a look and follow the link. And we'll move on to the 2021 Genetic Summit. So last, our Genetic Summit for this year has the theme of connecting the dots, and it will be November 9th and 10th. You should have already received a calendar hold, but you will need to individually register when we get closer to November. We're rapidly closing in on our final agenda, but the summit itself will be virtual based on the feedback we received earlier this year. Continuing education credits will be available, but again, like the agenda, more to come on this in the future as well. We are excited to announce that you will be able to register at no charge, but that registration is not yet open. So again, we look forward to seeing you at the 2021 Genetic Summit on November 9th and 10th. And if we move into the last slide, this is just contact information for myself and Christy. Some of you may be familiar with my Texas Health Institute email, but for all things MSRGN, this Mountain States Regional Genetics @gmail.com address is best, but either is okay.